Carolyn Harris.
What a pleasure it is to serve under your chairmanship, Sir Edward, albeit I thought you were Mrs Moon. First and foremost, policy on drug use should be regarded as a national health issue. As honourable friends and colleagues have emphasised, we need better legislation when it comes to drug use, with far greater intervention and education policy surrounding drug abuse and addiction. The UK now has the highest recorded level of mortality for drugs misuse since records began. And nothing is more important than preserving the life of our citizens. Our approach to drugs is simply not doing that. It is time to consider all of the options based on what is the most effective in reducing harm. The war on drugs is failing. People are being exploited by drug dealers and traffickers on an industrial scale. The rise in county lines and sexual exploitation highlights the need for criminal action on the perpetrators. Greater training and funding to frontline services is essential in order to crack down on the gangs and individuals who treat people like commodities, inflict pain, suffering and sexual abuse on vulnerable people. Traffickers are targeting potential victims. This includes cocoon, where drug dealers befriend vulnerable addicts and supply them with narcotics by moving into their homes. They then threaten to withdraw supply of drugs or use threats and intimidation to get their victims to sell the substance. Homeless people are increasingly becoming victims of modern slavery, lured by traffickers with promises of work, housing and narcotics. They are then used as forced labour to sell drugs or other forms of criminal exploitation. This year, we have seen a doubling of the number of British people coming into statutory support services after being identified as victims of modern slavery. Many were homeless and had existing drug addictions that had made them a target for traffickers, who then used their addiction to coerce them into harmful activities. And an increasing number of people have been identified as victims of slavery, ending up destitute, homeless and re-trafficked shortly after exiting safe houses. Addiction is an illness. Young people are selling themselves for their next fix and joining dangerous and abusive gangs to ensure that addiction is fed. Far more needs to be done to ensure children are educated on drug use in schools and educated on the associated dangers that addiction brings. We're not talking about recreational drugs. We're talking about people who are dependent on a substance which dominates their ability to function. Involvement in the criminal justice system often results from both illegal drug taking and criminal activities to obtain these drugs, and the destructive behaviours are often caused by brain changes triggered by drug abuse. Treating drug-involved offenders will provide us with an opportunity to decrease substance abuse and reduce associated criminal behaviour. Commitment to expand drug treatment facilities is essential in ensuring a way to cut the numbers of people who are addicted and to keep them out of the criminal justice system. Currently, we are failing people who are addicted to drugs. We have to look at where we've gone wrong. Drug addiction is not getting better in any way, so the current system is not working. It is much easier for people. It must be made much easier for people to get the treatment that they need. Facilities for treatment for people with drug issues must be improved and increased. Drug reform would be an opportunity to address the issue in the criminal justice system. It's time to think differently about punishment for drug-related offences, increase the treatment budgets to prevent addiction and drug-related deaths. Change drug policy so that police forces up and down the country have a uniform approach to drug addiction and allow them to better tackle the drug battle that is currently permeating all our towns and cities. Thank you.
Minister.